I am Dr. Rahul Nagpal. I am heading the Department of Pediatrics and Neonatology at Fortis Hospital, Vasant Kunj. My department deals with children ranging from preterms to 18-year-olds. Our department is a full-fledged department with all the pediatric subspecialties like pediatric neurology, pediatric gastroenterology, pediatric hepatology, pediatric cardiology, and pediatric gastroenterology. They all exist. We have specialists covering all these areas of pediatrics. We also have a state-of-the-art of pediatric ICU where we deal with very serious children, and it is an intensive care for small children. In this pediatric ICU, we take admissions from 1 year onwards. We have dealt with many dengue patients, we have dealt with many rare cases and very serious cases. The recent case which I remember was of a snake bite. He was a viper snake bite, and we managed to save him after 21 days of admission. We also have a neonatal ICU. The neonatal ICU is equipped with the latest equipments for the care of the newborns and the preterm babies. And our neonatal ICU has about 9 beds. All the 9 beds are equipped with the latest gadgetry, including the ventilators, which include the high flow ones also. We many times are dealing with children who are sometimes left aside by some parents who cannot afford these babies. And why I am saying so is because recently we again had a small baby whose weight was about 900 grams, and we found him on a street. In fact, the police caught him, and we handled that child, and he was with us for 3.5 months. And this baby not only survived against all odds, but is now in an adoptive family and doing very well. She still comes to us. Recently, we also have managed to save a baby who was 680 grams and was born at 25 weeks of gestation. This baby was hardly viable, and this baby had severe respiratory distress, neurological issues like intracranial hemorrhages. This child had repeated seizures. We were very worried that whether this baby can even see or sense anything. But again, after 2.5 months of admission, and now recently about 10 days back, we discharged the baby at a weight of 1.7 kilograms, which was very heartening. And the baby is not only thriving, is very happy with the parents. The parents were also very supportive with us throughout this journey. Our OPDs are full of children, and in fact I am very proud to say that our OPDs are one of the highest with the footfalls of pediatrics. Again, our pediatrics OPDs consist of not only the departments which I said, but also a well baby clinic. The well baby clinic consists, which is thought to be very simple, but this is the most important thing. For a pediatrician and for pediatrics, we all should know what is normal for a child. And here our well baby clinics work their wonders. We also are now developing a development clinic for the children who are requiring or who have special needs. Soon enough, those things will also happen.